Welcome to this Health and Wellness webinar brought to you by Austin Black Physicians Association, also known as ABPA. The mission of ABPA is to improve the health disparities within our community and to inspire and nurture the next generation of Black physicians. If you would like to know more about ABPA and our mission and collaborate with us, please visit us at austinbpa.com to connect with us. Again, that's austinbpa.com. The purpose of these webinars is to have everybody in our community have an opportunity to ask questions to physicians and trusted voices to improve their health in the best way possible. So please share this webinar widely. Today's topic is COVID-19, and this topic is important to the Black community because Black Americans are dying at a disproportionate higher rate than other populations, almost 3 times the rate of whites, due to the health disparities rooted in systemic racism. Joining us today are 2 Austin Black area physicians, Dr. Jewel Mullen and Dr. Michael Romaine. Thank you for joining us today. Could you introduce yourself? We'll start with Dr. Mullen.
Hello, I'm Dr. Jewel Mullen. I'm an internal medicine doctor, which means a primary care doctor. I work at Bell Medical School. I'm one of the deans. I focus on health equity or justice in healthcare for all people. I have a very, very strong lifelong interest in health disparities, particularly for people who don't have access to care and the right kind of care at the right time.
Excellent. Dr. Romaine?
Hi, I'm Dr. Michael Romaine. I'm also an internal medicine doctor. I do primarily post-acute hospital care in the North Austin area, North Austin Medical Center, the Cornerstone Hospital Group, as well as some of the skilled nursing facilities in the area. I've been in town for about 25, 26 years doing the same kind of work. So I've seen quite a bit, and this is something totally new to most of us.
Definitely. So Dr. Romaine, can you tell us a little bit, what exactly is COVID-19 and why is it important for us to understand this is infectious disease process?
COVID-19 is many of us heard and don't remember, is a novel virus. It's part of a group of viruses, but it causes significant and severe respiratory syndrome that is life-threatening, not always fatal, but can be life-threatening and can move very quickly as in terms of its ability to cause disease to progress, as in terms of shortness of breath, being put on a ventilator, etc. Initially when it first started, people were saying that it was the same as the flu, and we quickly found out that the mortality rate is much higher than the flu, and the morbidity rate, how sick you become, is much higher than the flu. Therefore, as you can see with the numbers in the news, we're looking at 120,000 Americans who have passed away from this virus. Personal note, I am from New York City originally. My family is still in New York City, the majority thereof, and I've lost 5 members of my family to COVID-19. So it is something that is very real and very important that we all know something about.
Definitely. And Dr. Romaine, how is this disease transmitted, and when would people know if they had this disease?
Typically respiratory droplets. That's why you have the whole issue of wearing masks so that we can kind of decrease the amount of respiratory drops we have, as well as social distancing to keep people away from one another. The incubation time is anywhere between 2 and 14 days. That doesn't mean, some people said 14 days and, so they didn't think if they got symptoms before that time that it was COVID. Yes, you can have symptoms before the 14-day period of time. Major symptoms are cough, typically productive. Most of the times it's clear sputum, or what we say, like that clear stuff that you bring up. Low-grade fever does not have to be high fever. General body aches, myalgias, malaise, as we call that. Many people said that they lost their sense of smell and their sense of taste early on with the symptoms. But it can progress very rapidly to become severe illness, and in some people it could be very mild, not mild, but to the point where you don't have to go to the hospital.
What do people expect if they do have to go to the hospital?
Well, I think there's some social things that you have to expect. If you do go to the hospital and you're being ruled out for COVID-19, you will be placed in isolation. Your family will not be able to visit you during that time because, again, we're trying to decrease the spread of the virus. It depends on how sick you become. Some people rapidly progress to the point that they're admitted to the intensive care unit and then they're put onto some kind of positive airway pressure breathing where they basically, it's not where the tube is down your throat, but where they're forcing air into your lungs. It can progress to the point where if you don't do well, that you get onto a ventilator where the machine is basically breathing for you. There are different types of beds that rotate you to try and get those secretions and everything out of your lungs so that you can breathe better. But from what we have seen, it can affect pretty much every body system. People can rapidly go into what we call shock, which means that their blood pressure drops. That can affect your kidneys. That can affect your brain. It can affect the perfusion of your extremities. So to be very honest, we don't know as much as we think we know about this virus. As things moved on, we saw more and more things happen that we weren't expecting.
Dr. Mullen, I know you've been actively involved in the community with prevention and everything. Can you share some of the ways that we're handling that in the community right now?
Yes. I have spent a lot of time, especially recently, reminding people that for everything they hear about coronavirus, there are things that they can do to protect themselves. And as we keep hearing more and more stories about the numbers of cases going up, I want to get louder and louder with the reminder about how we can protect ourselves and how in doing so, we're actually protecting others, the people who are in our households, the people we work with, people we care about, the people we don't even know. Dr. Romaine already said, coronavirus is a respiratory virus, like the flu, like colds. So coughs and sneezes that make people spread germs are the kinds of things we prevent against by covering our faces with masks. And some people don't want to wear masks because they feel it's their right not to. Early on, some people were afraid to wear masks because they thought it was going to attract law enforcement. Other people don't want to wear masks anymore because they're just tired of it and they don't think they're at risk. Since we know that there's no pill you can take and no shot you can use right now to prevent coronavirus, those simple things that are in our hands that can be on our face are one of our most effective tools. And speaking of hands, washing your hands, hand sanitizer is another one. And there I recommend people don't just put bleach on your hands, as some people have done, but to really pay attention to the messages about what the right kinds of hand sanitizers are. You don't have to go out and spend a fortune. Some of them you can make at home, but be careful with that. The other thing that I want to say about prevention is we've heard a lot about the worst cases of COVID, the ones that land you in the hospital. And even though coronavirus has hit the Black community harder, still fewer people end up in the hospital than have to go, especially younger people, which means young people can sometimes think they're not at risk. They're like some members of my family. They go out, then they come home to other family members, older family members, grandparents, and others where they're potentially exposing them. So being mindful of that gets to the next piece, which is no matter how much you love somebody, right now, one way to show you love them is not get too close to them. That whole thing about physical distance, that's 6 feet away. These are some of the simplest prevention tools we have right now, and they don't cost a lot. When they first said, make a mask at home, I went and found an old t-shirt. I didn't have a mask and I'm a doctor.
Right.
I ripped up a t-shirt and said, okay, I'll use this until I can get something. So it doesn't have to be fancy.
Very nice. And what about if you do come down with COVID? How are you supposed to social distance if you live in an apartment, or better yet, you don't have extra bedrooms? What are your recommendations for that?
If it's okay, I want to fill in one blank.
Okay.
Because what about if you do have COVID means you went and got tested for it?
That's right.
right? So on the prevention side, another thing to think about, especially for protecting yourself from getting extra sick and protecting others from spreading it to them, is for all of those symptoms that Dr. Romaine mentioned, or if you think you've been exposed, to really look into getting yourself tested so that you know, and don't hesitate. And if you are tested and get sicker or don't feel well, know that one test isn't necessarily the guarantee that you're not sick. Sometimes the test turns positive later. Don't be afraid to get tested. So even in Austin, the city, the health department and the city of Austin have set up places where workers who have been exposed at work, or family members who just have been exposed in the community, might say, I'd rather not go home and expose other people. So to look into the hotel rooms that they have set up for people to be able to stay there and not infect others is one way. Another is to stay in one room as much as possible. Have masks, even if it's those simple homemade ones, for other family members. Hand washing, not sharing food, not sharing utensils, doing as much as you can to keep the distance. And then the third part I would say is, if somebody in the household is sick, to reach out to the health department to say, we are in a household with lots of others. What should we do? What else can we do? Should others get tested and when? Those would be some of the first measures that I would recommend.
Excellent. So when we look at self-quarantining versus self-isolation, can you talk a little bit about that?
Yes, some people hear those words quarantine and isolation, and even for public health professionals, they throw them off. And here's the way I would think about it. What do you do if you might get sick, as opposed to what do you do if you already are sick with the infection? So quarantine is the protection just in case you get sick, where you really cut down as much as possible on being around other people in the event that you do get sick and spread it. If people who are already diagnosed, then isolation. And that's what Dr. Romaine was talking about, even if you're admitted to the hospital. That is keeping you separate. It's not solitary confinement forever. It's keeping you in a place where you have less of a chance of spreading the infection while you are getting better and while your risk of spreading the infection goes away.
I think Dr. Romaine talked about as well, these are respiratory droplets as well as airborne, the method of spreading. So it's important to understand that by putting the mask on, you're preventing other people from getting these respiratory droplets when you cough or sneeze. And that's the crucial part, that we all have an obligation to protect our community. So Dr. Romaine, can you tell me why Black people are more likely to die from COVID-19 than other populations?
I think that, as Dr. Mullen said, I think part of it goes along with the, basically health disparities in general. Is the availability of care, seeking care at a later date. Those things play a big role. For the most part, the care is supportive, but the supportive care that you get in the hospital is a lot better than the supportive care that you would get at home. The amount of oxygen, the fluids, the things that would, help your body to fight this virus off. So I think that's a big part of it, is a matter of that, for some reason, and I'm not going to, we know the reason, I don't want to just say what the reason, that there is a disparity in healthcare in general. And we've talked about this, I've talked about this with my patients forever, about everything, diabetes, heart disease, everything. And I don't think that they've ever, from my readings, have seen anything physiologic different between African Americans and other people who get COVID. So it's got to be something else besides that. And that's the big thing that always seems to come up with our population and with our community. And again, we have to get past the point of not wanting to see the doctor, not wanting to get tested. We have to get past that point, especially if you're symptomatic. And even if you've been exposed, so that you don't expose other people. I mean, because I think you said the big thing is that this is basically a fight for our community and a fight for humanity. I mean, it's not a matter of like you taking a gun to your head and you're ending it for yourself. You get sick or you get exposed and you don't tell anybody, and you spread it to everybody around you. Then they spread it to everybody around you, and within your community, everybody gets it. So we have to be more aware of that, and more understanding that it's not a death sentence. If we go get tested, and suppose we do have to go through the 14-day, isolation period or whatever it may be, or go into the hospital, at least we understand who has been exposed, who we've been in contact with. You can save a life by testing yourself if you've been exposed. And I think that's one thing that we have to get across to everybody of how important that is with this particular type of virus.
Excellent. Thank you. There are different types of tests. Can you explain to people what kind of tests to expect? I know there's antigen tests versus antibodies. If you could explain a little bit about that.
Correct. So there's antibody tests that say, there's two different types of antibodies you're going to look for with the blood. It's IgG and IgM. IgG means that you previously had it. IgM means that you've had it recently. You still have it or not? Not because there's a period of time where you go from the IgM to the IgG. The antigen test, with the swab and everything that everybody talks about, is done through PCR polymerase chain reaction, which means that they amplify the viral particles to see if you actually have the virus in your system, which means that you have an active infection at that time. They do most of those through a nasal swab. They do some of them through saliva as well. I don't think the saliva is available here in town. I think most of the ones that we've been doing have been the nasal. But this basically says you have the actual virus in your system.
So the nasopharyngeal swab, I know, has been said to be a lot more accurate, but they do rapid testing. And then if you're still negative when they do some of the rapid testing, then your doctor tells you to go back and get another test, the molecular antigen test. Can you explain? Some people are frustrated regarding, why do I have to have two separate tests?
I'll be very honest. When this first came out, the testing has been evolving over time. We had people coming into the emergency room, and even the ER doctors were saying, and the infectious disease doctors were saying, the test is only 70% accurate. They would come in and they had all the symptoms of COVID, and they do a test, and it's like, well, they didn't have it, but they ended up having it, going back later and getting an IgG. It's like, oh, well, they did have it. So, what they're doing is, if you have a highly suspicious case, they are going to do confirmatory testing on you. That's just the bottom line. I mean, whether it comes back negative, they're going to say, okay, we need to now go to the next step and do something else, either molecular test or another PCR, or whatever the case may be. We're going to try and find out, because your case is very highly suspicious to be a COVID.
Excellent. So, Dr. Mullen.
Hey, may I add something to that?
Yes.
Sometimes it gets frustrating if you hear you have to get a second test. Sometimes it makes you wonder whether or not you got the good test the first time, whether or not, and I've had conversations with family members as recently as today, worrying that they got something second class because they're Black. A repeat test, when somebody's still concerned about you, is not just an expression of concern, it's an expression that they're doing their job. It can seem frustrating, it can seem unnecessary. For some people, though, it can even make them feel like they're being experimented on. For everything that we're saying is no joke, another opportunity to be tested when you're not well and people are worrying about you is a reflection that people are taking it seriously. And I think as long as we're still worried about whether or not we are being treated fairly in our medical care, that's also an important reminder, because sometimes people give up on the system when they need the system's help the most. Thank you for letting me break in with that.
Oh, no, absolutely. Thank you, Dr. Mullen. One of the things, as you brought that up, Dr. Romaine, that I've heard from people, and some of the questions our viewers have asked in the past, has to do with, well, when do I go to the hospital? Do I call my primary care doctor first? Do I go straight to the ER? What are the emergency symptoms in which, how do I act? Because I don't want to go to the hospital and be exposed to somebody who's going to give me COVID if I may not have it. So can you explain a little bit about that?
Sure. The thinking has changed it has changed over time since we've had more testing that's available. Initially, the testing was so much sparse. So we told people who had mild symptoms, low-grade fever, cough and congestion, self-quarantine for, 14 days or self-isolate because you're possibly positive. And if you had worsening symptoms, you became extremely short of breath, basically extremely weak, higher temperature, unrelenting cough, that you should go to the hospital. And that stays the same for right now, that you should go to the hospital if you have significant and severe symptoms. It's nice to call your PCP to let them know you're going, but they're going to tell you go to the emergency room. Now, if you have suspected symptoms now, the testing is such that you can call your primary care physician and go through your exposure, why you think you need to be tested, what kind of symptoms you have, and you'll probably get a test now. There are testing centers, as Dr. Mullen said, that you can go to, and you go down the list of your symptoms they feel is warranted, they will test you. So it's not the same as it was before, where we were trying to conserve testing for only the very sick patients. But right now, I would say, if you suspect, if it was just somebody said, you know what, we visited a while back and we're COVID positive, and we were just calling you to let you know, call your doctor and go get tested now that you can.
I'm sorry, if you suspect, can you go back to, if you suspect, call your doctor?
Okay, I think if you suspect that you've had exposure, if you suspect that you have symptoms indicative of COVID, call your doctor to go get tested. I don't think there's anything wrong with that at this point. The tests are now a little bit more, available so that you can get that. The other thing that you can do, what your doctor will do with you on a case-by-case basis, okay, tell me about your symptoms. Why do you think that you have, why would you think we should go down testing you for COVID? What is your exposure? And they'll walk these things down with you so that you, specifically for you, so I'm not just giving you some broad statement, call your doctor who knows you, who knows your history, and then you can get arranged for a test. I don't think there's anything wrong with that at this point.
Excellent. I know, Dr. Mullen, we had talked about the Austin Public Health. Can you bring that up?
Yes, and I'd like to add to what Dr. Romaine said about getting tested. And because Austin Public Health has also sent the reminder over the past few weeks that people, no matter who they are, if they've been out at any of the Stand Up for Justice, otherwise known as protests, also consider getting tested. Get tested because of the potential exposure out there. Austin Public Health, if you can't remember the whole number, to just dial 311 to get connected would be one way. Another would be to call the main number, 512-974-2000, to be connected to someone to talk through that. That would be really key.
Excellent, excellent. So after you're recovering from COVID-19, when can you go back out and be in public? How long do you have to self-isolate or quarantine?
For most of the patients are getting follow-up testing to make sure they're negative. So, after you recover, many people, are getting follow-up testing as in terms of being negative before they go back to work. It used to be before they were doing the follow-up testing, they made sure that you were afebrile for a period of time, and then they said, okay, you can go back. But most people now are requiring follow-up tests before they say you can come back and go to work.
So that's where you have to have 2 negative tests, 24 hours apart. Okay, got it.
Correct.
And no symptoms, you can't have a fever, you can't have all these other things. Okay. So if you don't have a fever and you don't have, and your symptoms have improved and it's been over 7 days and your follow-up testing is negative, then you're okay to go back out. Be around.
You're okay to go back out, but I must, warn people. This is the thing that I've talked to a few people about who have recovered. You're not the same, okay? So yes, you are past the acute infection. You've cleared COVID. You're COVID negative, but most people find out their endurance is not the same. Right. They still get short of breath with, much sooner than before. You open yourself up to other secondary infections if you try to push yourself like you did before you got COVID. So understand you were sick with a very terrible virus. You're getting better, but to go back slowly. Don't go back full tilt like you did before.
Excellent. Dr. Mullen, anything else you'd like to add regarding that?
Yes, especially now as we're seeing increasing numbers of cases. Depending on where you are, you might find out that they're still hard to get those second tests. And there might be times, depending on who you are and where you are, that people will say, we won't test you, we'll go by your symptoms. Some people are hearing on the news, people tested positive for weeks. 6 weeks later, they still tested positive. What do we do with that? And so as you factor in everything that Dr. Romaine just said, also know that scientists are still working to understand how it is that even after some people recover, their tests might still be positive, and somebody might say to them, but you're safe. So there's the general information, and alongside the general information is talk to the person who's been taking care of you for your most individual recommendation for what you need. One other thing I wanted to add about testing and being sick is something else that can make people feel touchy, and that's around personal information. Some people may have heard about contact tracing. So if you test positive, then you may end up feeling like somebody's really trying to get in your business by asking you, who have you been with? Where have you gone? Give us their phone numbers. And it can feel like terrible invasions of privacy. The reason for contact tracing goes back to so much of what we said earlier, which really gets to how spreadable, how communicable this disease is. And by finding out places that you have frequented where you might have exposed other people, it's an opportunity to warn them, even without saying that you were the person they were exposed to. It's, they don't say, oh, you were with John Brown and now John Brown is sick.
Right.
But you may have been exposed, and it would be wise for you to have somebody talk to someone about your symptoms and determine whether or not you should get tested too. Because that's the pay it forward I'll call it the chain reaction of prevention to protect our community.
So what it sounds like as we kind of summarize some of the important concepts are: wear a mask so you can prevent transmitting this virus to other people. Wash your hands for 20 seconds if possible, at least, with soap and water. Not touching your face, your eyes, your nose, your mouth after you've touched surfaces in the community and different places, and making sure you wash your hands before you eat or come from the restroom or anything like that. The most important way to prevent the spread of this virus, would you say it's mask or social distancing? Dr. Romaine?
It's a combination of the two. Social distancing is the most important way, or I say the best way of doing it. But in all reality, now that things are opening up and people are forced to go out, you have to wear a mask and try to social distance at the same time, which is sometimes a little difficult. But, if we can all socially distance, as we saw here in Austin, I don't think it's just a coincidence that once we started opening up, the cases started going up higher. And the biggest issue that we have seen is that people don't take this seriously. I talked to a patient the other day who went back to work, and he was advised, because of, again, we can only now advise people to wear a mask. He was advised by his employer that you should wear a mask. He said he talked to other people and he said he didn't feel that was necessary. So, we had a long discussion about this of the people that he talked to. None of them were health professionals. They were just people on the street. And again, there's a group of people that are out there that are very making this a political type statement. And I don't really care what politics you have. I'm just talking about the aspects of medicine at this point. And I told them, I told them the story. I told them the story about my family. I told them the story of the people that I was seeing. I was seeing a lady that day who was in the intensive care unit, who was on the ventilator still for 6 weeks because she had COVID. And he said, oh, wow. So really people do die from this. And that's what we're combating now in our community, that people are not believing the truth when they hear it. And back to the question that you said, social distancing is number one, but we have to deal with reality. So we're going to have to deal with wearing a mask as being number two.
I know.
As well.
I know, Mike, I also, as a physician, numerous people ask me all the time, well, you know, I don't really think COVID is that serious. It's no more than a common cold, or I'm so young, I'm not going to be affected, or I don't have any hypertension, I don't have diabetes, I don't have heart disease, I don't have any of those things. So I don't think it's going to really bother me. I get people saying that and saying it's not serious, and they don't know anybody that's died from it. And I too, like you, Mike, I've lost an aunt to COVID-19, and she was still relatively young. So it's very personal for me, and it's very frustrating when you have to really convince people that this is a serious disease that's not just impacting the elderly and the Black population. You know, it's impacting everybody. It has a huge impact. And I know, Dr. Mullen, you can attest to that as well. Um, Anything else you'd like to add regarding that?
I agree. Mask and social distancing, it's not either or for me. I'm older, so I also pay attention, even no matter what I want to say to myself about myself. I am older, a really, really healthy but older person now, just by age, which means I pay even more attention to keeping distance. It's still true and still considered true that being outside and being around people farther apart still is probably safer than being inside. But I don't just randomly take my mask off as soon as I walk outside either. I'm careful about things like riding elevators. Some surveys have shown that if you compare Black people to white people, many more Blacks, African Americans, know somebody, a friend or family member who has had COVID. Now, I'm fortunate to be able to say that my cousin in New York City, I'm from New York too, was hospitalized with COVID back in March. After being sick at home for a week and ended up going home and was better. And by the time he was better by the time his tests came back. And that gets back to sometimes the tests were taking a long time. But I'm also really fortunate to say that my mother, who's 90 and in a nursing home, tested positive and never got sick, which is not the story that we hear. But in both cases, they were tested. In both cases, they were treated. They were observed by physicians. Their symptoms were followed. And those things make a big difference.
Excellent. Are there any other misconceptions about COVID that either one of you would like to add besides taking hydroxychloroquine early or anything like that?
Well, I think the big thing is what both of you said about, you know, the younger people and people who feel that they don't have any past medical history, that this is something that they can just fight off easily. And I've told them, I said, I've seen both spectrums. And I really can't say rhyme or reason why one person got better and one person did it on a regular basis. I've seen the mild cases where even one of my colleagues, he had it and he was down for about 4 or 5 days at home and with fever and coughing, and he's better now. And then I had another person who had it, no past medical history. And they're, like I said, this is one that's still on the ventilator at this point. I just try to explain to people, there's no reason to take that chance. The best way of trying to fight this virus is through education and prevention, and washing your hands, social distancing, wearing a mask. This is not a political fight at all. This is really something that none of us in our lifetime has seen before. And you know, the issue of the hydroxychloroquine, as you mentioned, I don't know what to say about that. I really don't. You know, for a while it was under emergency FDA order and they were using it. Infectious disease was advising us to use it. And then the findings came out that it was not effective. But the issue of passing on information based on emergency approval for a formulation without having data by an authority figure, to me, is completely irresponsible.
And obviously, Dr. Romaine, we don't have a treatment for COVID at this time, and we're still trying to obtain a vaccine, which it doesn't look like it's going to be as soon as people think it is. So at this point, I think Dr. Mullen and you have both encouraged people to help us in the prevention of spreading this disease. The other thing I'd like for you to mention is the predisposing conditions. What would you say to the minority population who has more hypertension, diabetes, heart disease? What would you say to them in terms of what do you need to be doing right now to make sure that you're taking care of yourself? Jewel?
Well, we can roll that into the prevention message once again. Part of what makes having those underlying conditions more of a setup for being sick is the combination of trying to control the underlying conditions that are harming our body at the same time that COVID is. And so as much as possible for everyone today who's listening to this to say, okay, so what did the doctor say last time I got my blood pressure checked? And if you can't remember when it was, well, or what did the doctor say about my blood sugar? And to really keep knowing that underlying conditions don't doom you either. There are things that we can do for ourselves just to take care and follow the advice that we have. So that would be the first thing. I always worry when we share messages about risk where we're almost sending a message to people that they're doomed.
Yeah.
Part of what I want to remind people is we're not doomed. We're not doomed. And what I used to practice with my patients, standing up for themselves, not being satisfied with getting information that wasn't clear or that seemed like it was rolling out too slowly and wasn't helpful. We literally used to role play before they would go off to specialists and other, because part of getting the care we deserve is standing up for it. And I really believe that's something else that we can help with. Choose the advisor that you trust and take the health information from them. Keep it consistent. Cloud out all that other stuff that we know is either political or just not based in science. Maybe the trusted messenger is the Austin Black Physicians Association that's really getting information out here, but stick with that and keep arming yourself with that to know what else you can do, and use that information to also stand up for yourself.
I think, Dr. Romaine, did you want to add anything else as we're nearing the end of our talk today? One thing that you wanted to add about COVID-19?
No, I wanted to agree with everything that Dr. Mullen said. And I think that the big thing is you have to be your own advocate and ask questions. And, the thing is, care is available if you ask. The big thing is also educate yourself. We can all do that by looking at reputable sources online, as in terms of numbers in your own community, risk factors for different things that may happen. I think that we have to all be aggressive with our own care, aggressive with our own health, in order to combat something even just like COVID. COVID's not the first virus that is going to come out. There's going to be another round of some other viruses that come out. And whenever you have, predisposing, other illnesses such as hypertension, diabetes, you're going to be at risk. And that's why your doctor always harps on you about, your blood pressure, harps on you about your sugars, harps on you about your cholesterol, all those things, because they're not talking about today. Like, they're not saying tomorrow something's going to happen to you, but in the future, this will put you at risk for things. This will put you at risk for other things, not only the disease or the end organ damage by these different diseases, but other things that may happen. So I think this is a wake-up call for most of us, that we have to understand that that's why your doctor was talking to you about these things. That's why it's important. And you're your best advocate. When you leave the office, it's up to you. It's up to you to kind of, understand what you need to do for your own health, as well as taking care of your own family. So I think that, what Dr. Mullen said was spot on.
Absolutely. I think a lot of people are surprised their doctor has been bringing up their weight lately. But what we found is with COVID, obesity was a predisposing factor. It was a significant factor, Dr. Romaine, in the people who died from COVID.
Correct.
You know, there's a reason that we're treating obesity now. Your doctor's not just saying you're fat. They're sitting here trying to reach out to you to say, let's get your health under better control. Let's improve our diet. So I just want to thank you so much, Dr. Jewel Mullen and Dr. Mike Romaine. We're grateful for your time and expertise, and thank you to our audience for listening. Wherever you are, ABPA wants to continue its mission to further improve the health disparities within our community, and we're grateful for you joining us. And please let us know what we can do to help you by logging onto our website, austinbpa.com. We will be having weekly seminars and series on obesity, hypertension, diabetes, mental health, the different areas that affect our community. So thank you very much for joining us, and we look forward to talking with you again. Thank you.